Oh boy, this pregnancy business. Holy Hannah, can it throw you for a loop? You've got the aches and the pains and not to mention the weight gain. It throws everything off balance, right? But a lot of moms can find relief from a family chiropractor.
Yeah, and as TCL reporter Kelly Hansen explains in today's Be Well with TCL, once those moms have their babies, those little tiny infants can start getting adjusted too. How, you ask? See for yourself.
At 39 weeks pregnant, Sei Phao is more than ready to complete her family of 4 with a new little girl.
I have a 2.5-year-old, so I'm busy at home, chasing after him, and so it's been a little bit of a different pregnancy this time too, so just to make sure my body is balanced, and it's definitely helped a lot.
She's been getting routine adjustments for years and even married a chiropractor, Dr. Jeremy Phao.
It's really about how do we bring balance to a system.
They both have been working toward a healthy and safe delivery, just days away.
The chiropractic adjustment, especially during pregnancy, is very gentle, very safe, very effective, and the aim is very different than your traditional chiropractic.
Dr. Phao sees many expecting mothers every week, like Nikki Keekley, who is also inching closer to her due date.
When everything's aligned, like when everything's straight, everything works.
Okay, hold your feet together nice and tight for me, don't let me pull apart. Almost all women that come in here that are pregnant want that. They want a natural delivery, they want as few or no interventions as possible. So they're looking to have the most natural experience that they can, and this is one way to help prepare their body in order to do that.
Ingrid Barnett is 22 weeks pregnant with her first baby and is hoping for a natural delivery.
I really haven't had too many uncomfortable moments yet, and I credit that to coming in and getting adjusted and being aligned and the baby having as much room as possible.
Dr. Phao says getting the pelvis balance is important to set moms up for the best labor and delivery.
We think about it like communication, that any pain or symptoms they're dealing with could be a communication signal that their body is not where it should be.
A week after we met Sei, little Yuna came into the world.
You wanted a VBAC.
Yes.
That was very important to you.
Really important.
You had a cesarean section and you wanted to have her vaginally, and that is what happened.
Yes, and
right?
so after 3 pushes, she came, and I couldn't believe it.
Sei says her body just knew what to do and credits her chiropractic care. Now it's baby Yuna's turn.
We forget about how stressful it might be on this little tiny body.
Within days of delivery, Dr. Heather Steckling gave Yuna an adjustment.
Just being a little bit alert about it, because she's aware of what I'm doing, but it doesn't hurt.
Many kids are brought in with colic issues, difficulty latching, not feeding properly on one side versus the other, not taking a bottle, not, anything that isn't proper development or they're delayed. We see that, and we see really good results with that as well.
So we're talking a bit about babies. We're not talking about an adult adjustment. This is something totally different.
Right, it's a totally different technique because their bones are totally different than what an adult would be. So we're actually feeling the bones and the muscles right at the top part of the neck, and usually when they go through the birth canal, that's kind of where all the stress and the tension goes immediately.
Both Dr. Steckling and Dr. Phao recommend babies get adjusted within 24 hours of delivery because a happy baby can make for one happy family.
Super cute baby. We're all in super cute baby mode there. Yeah. Hey, Kel, one thing I noticed there, so you have moms who are pregnant or moms to be, and look like they're lying on their stomach. How does that work?
Yeah, some adjustments need the mother on their stomach. So what happens is the table actually lifts the pelvis, and so their belly just hangs. And the moms that were there told me it's super comfortable. Maybe it's hard to get up there, but once they're there, they don't want to move. And
I've heard of some prenatal massage places doing things like that too.
Kind of opens up the bottom of the table.
So it's not like you're pressing
so you're not
on the
laying
tummy.
on the stomach. It looked kind of startling. That's why I wanted to explain that they're not laying on their stomach, but there is a space for their belly to hang.
Okay, so when you're looking for a chiropractor to handle prenatal issues and then little tiny babies, you want to look for someone who has experience with those, right?
Right. So mychildchiropractor.com, it's a great resource. You go there. There are 7 chiropractors in the metro that focus on prenatal care, kids, taking your child to a chiropractor maybe seems a little scary. Yeah. But my daughter goes and I ask her, does it hurt? And she smiles the whole time. So they're a great resource. And the 7 doctors there last year, I was told they had 50,000 pediatric office visits in 1 year. They see hundreds of kids a week. So They know what they're doing, and you can find all their information at twincitieslive.com.
I don't know. I just heard him say if the baby isn't taking a bottle. I mean, and that's like your
deal.
worst fear if you ever want to leave your child. Like, you know, go get a pedicure or something.
And little baby Yuna, you know, she was just, Dr. Seckling was just pressing on that bone there.
Yeah.
And I watched the baby, she like just, it was like release, like just.
Can they tell us where that bone is so we
Just
as
press
parents
right
can
there.
just sort of do it
But
right
that
at
whole
home?
travel through the birth canal is like a stressful operation for these little tiny
I believe
humans.
it.
And you know, said she pushed 3 times, so that baby came like that, and so that can be traumatic on the baby.
Yeah.
So just even getting that looked at, I think, is important.
Awesome, Kelly.
Yeah.
Thank you so much.
Kelly.
You're
So we
welcome.
posted a link to help find a child's chiropractor at our website, twincitieslive.com. We also want to thank mychildschiropractor.com for sponsoring Twin Cities Live. See you soon, Kel. Up next, we're going to tell you how pencil pants